everyone, this is Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Thank you so much for joining. Today I'm going to be talking to you about something near and dear to my heart. I'm going to be talking to you about my story. I'm going to be talking to you about how I entered into this metabolic, anti-inflammation, and insulin resistance health space. And I'm going to be sharing with you some of my own personal struggles and story that led me to help women in this really cool and unique way. I want to show you a picture of my family. These are my 3 boys and my awesome, amazing, loving husband. Getting to this place of a really beautiful family was actually quite challenging. It took us a long time to get to where we're at. And I followed everybody's advice about routine gynecologic care, and it was really struggling for me. I was really having a hard time creating what I imagined, what I thought was supposed to be the best thing for me. I had my first son without any problems, and I had a very successful full-term pregnancy with a vaginal delivery. That was when I was in OB/GYN residency. I went on to graduate and I started a really amazing, successful job that everyone thought was the pinnacle of generalist OB/GYN success. But I was working really hard. And once we got to the space where it was time to have our second, I started having a hard time. And my periods started getting heavier, and I started having a little bit more pelvic fullness. So on a whim, I just asked one of my colleagues to do an ultrasound for me to see if there was anything going on with my pelvis. And lo and behold, we found a 9-centimeter endometrioma. And an endometrioma is a blood-filled cyst that is related to endometriosis, which I'll share exactly the details of that disease later. And it was a big reason why I was starting to have progressively heavy periods. I mean, I'm talking really heavy, like lasting us 7 days, going through a pad an hour, sometimes having accidents. And I thought, how is this possible? I am an OB/GYN, and how did this happen to me? So I went to see my gynecologist, and we ended up having surgery to remove the endometrioma, but I also ended up having to remove that ovary because the ovary was so involved. So the gynecologist did a really great job, and when we were talking about what to do after to prevent further progression of disease, the recommendation was to start birth control, which is really hard for ladies to feel and hear because if you're looking to have another baby, birth control just doesn't make sense. And I started to get a glimpse of really what my patients feel when I talk to them about treatment for endometriosis. And if they're childbearing and desire future fertility, it's really hard to hear that advice about ending your chances of being fertile to reduce the inflammation that causes the disease to progress. And so I started to grow a little bit dissatisfied with the current recommendation for endometriosis care, which was really hard because I had trained so many years and done so many surgeries, and now I started to understand what patients were really feeling. So I started to do a lot of work on my own, and I started reading a lot of literature about inflammation and about what nutritionists and naturopathic doctors started to understand what endometriosis really was. And a lot of the information I was reading had to do with diet. And so one of the big themes that I learned was about gluten and how gluten raises inflammation and makes endometriosis worse. And that was kind of the big thing that I learned. So I went gluten-free. And it did help a lot, but I still continued to have a lot of heavy periods and difficulty with getting pregnant. My periods were my periods were every month. And I was kind of doing just making sure my life was a little bit more balanced. But after about a year and a half of trying, I still couldn't have a baby. And so I started doing some blood work, and my blood work was normal. And I even looked into advanced reproductive technology, and I just felt like something wasn't right. And so then I started to look out externally about my job and how much sleep I was getting and how my career affected my health and whether what I was doing was really satisfying for me. And so I made the really challenging choice to quit my job. And once I did that, I got pregnant right away, like the following month. But unfortunately, I had a miscarriage. And not even a couple of weeks later, I was able to conceive again. And that was really striking to me because I thought, wow, maybe it's not just diet, but maybe it's also external forces like stress and career satisfaction. So I ended up finding a little job where I just worked part time and really just nourished myself. And then I transitioned to my current job where I work at a large academic medical center that promotes a lot of research and investigative thought. So that really helped me progress and really start to cultivate the thoughts about what was really going on in gynecologic health. I went on to have my son, and he was a full term baby, vaginal delivery without any problems. And then as I continued and working in my academic medical center, and I was super happy, then I got pregnant again right away without even really trying. During that time, I was 120 pounds, super happy with my job, still gluten free. And then I started to progress in my prenatal care, and I took my 1 hour glucose tolerance test. And that's the first test that we use to check to see if there's gestational diabetes in a pregnant lady. And then when I took the test, my glucose level was 197. And I didn't even decide or bother to do the 3 hour test because it was pretty clear that I had some major insulin resistance and glucose intolerance. And I was very shocked because I, again, was doing everything that I thought I was supposed to do. I was exercising a little bit, I was pretty thin. The only real risk factor I had was being a little older in my pregnancy, but also being of Latina heritage. But 197 is pretty shocking. So I went ahead and started learning about gestational diabetes diets and to reduce my carbohydrate content. And at that point, I realized that even with a little bit of carbohydrates during my pregnancy, my sugars were off the chart. And so I really had to reduce the amount of sugar in my diet completely, which was almost kind of a shock. I actually went into this crazy carbohydrate withdrawal where I started to feel like I was having like addiction feelings where I couldn't think about anything else but having something to eat, and I grew really hungry. And that lasted a couple of weeks, and then it really started to stabilize as I added more fat and protein into my diet. And then I went ahead and had my vaginal delivery without any complications at full term. And during that postpartum maternity leave, I started doing some thinking about, wow, there were so many layers of body inflammation that were starting to impact me at various stages of my life. And during the postpartum period, when my period returned, it was a lot lighter. And I started thinking, what's going on here? Was it related to the reduction of carbohydrates? Was it related to the decrease in stress I had? And I really started to look into how carbohydrates might cause body inflammation. And I stumbled upon the Nutrition Network. And the Nutrition Network is a wonderful organization that produces educational content for both doctors and lay people about how much carbohydrates cause body inflammation and insulin resistance. And a lot of the information was about heart disease and kidney disease and stroke and cardiovascular disease. And I thought, if the body receives endothelial inflammation, body inflammation, and the effects of insulin resistance on the other end organs, like your heart and lungs and kidneys, then what is it keeping the uterus from receiving that inflammation? How about the ovaries? If our blood vessels grow and feed all of the other organs, then could it also be that my difficulties with fertility, with endometriosis, and gestational diabetes were all iterations of pretty much the same problem? So I really started to learn and understand that perhaps the root cause is body inflammation and insulin resistance. And although gynecologists and doctors are really great at treating heavy periods, endometriosis, infertility with medications like birth control and surgery, maybe it's that we're missing the point. Maybe it's that we need to teach ladies how they got there and then leave it up to our patients to decide how they want to approach their problem with perhaps lifestyle changes, medications, or surgery. Because really, that's all it is. So many women want to understand what brought them there. And then I really do feel like women can decide what is best for them. For me, I really believe that understanding my inflammation factors and how sensitive I was to carbohydrates really did promote an improvement in my gynecologic health as a woman. And so I'm just so excited to share this with you. And I really do hope that you're able to take a piece of it to help improve your own gynecologic health. If you like this video, please share it or subscribe to my channel, or maybe share it with a friend. Thank you so much for listening to my own personal story, and I hope that it helped you or maybe a friend or someone that you love. Have a great day.